So we're going to talk through basic pad placement for a tight quad or trying to activate a quad. We always want to check before and after so that everyone's got an idea of, what kind of results we're getting here and kind of where we're at, what we're starting with. So Chris, you want to just do a standing quad stretch to the best of your ability on the mat. Okay, let's check the other one and get a sense of which quad feels a little tighter or is a little limited. Once again, this is just a basic test to check tightness and flexibility.
The left feels a little
tighter. The left feels a little tighter? Okay. This is just my preference for pad placement. Go ahead, pull that pant leg up. Black up high, rec fem or in that area. Red from this channel, red from this channel a little lower. The idea is to try to get as many of the synergistic muscles as possible, but then lots of times I'll pad black VMO vertical like that. And once again, this is just my pad placement that I use. Tim, yours might be different.
It's just really important to remember that we're really trying to activate the areas of the muscle that are tightest and shortest. So by doing specific muscle testing and testing different areas of the quad, you may find certain areas being tighter than the others. The tight ones are our targets.
So we're at 250 frequency. We just turned the power button on. We're gonna take it up by threes until Chris gets to, we always say on a scale of 1 to 10, 7's where you say stop. We wanna operate in a 4 to 5 to 6 range. I'm gonna click the bottom knob, which is 3%, until Chris tells me that he feels some stimulus.
Okay, just starting to feel it.
Okay, so that's a 1. And then from there, I'm gonna take it up by 0.5 till he gets to a 4 or a 5. I always watch their face too. Facial expressions are telling.
And does the muscle always contract in your experience when someone's hit their limit, or do some muscles not have to contract?
I try to stay below the point of where you start to get somewhat of that contraction. But once again, one of the benefits of the technology is that even though you're getting somewhat of that contraction, you're also allowing the brain to understand to release and relax that muscle. So sometimes it almost feels like that's a protective kind of guarding mechanism where that area has been tight and protected for a long time. And now you're trying to get to the point where you can kind of convince it to relax and release and let go because it doesn't need to hold on anymore.
Yeah, that's great to know because in some of my patients, they're contracting very heavily in there and I have to reduce that treatment because I don't want to overwork that muscle. The body's in a pattern. It's been in a pattern a long time and we have to respect that. We don't want to take it out of the pattern too quickly.
Yeah, I think that's a great point. Less is more with all of this. I mean, I think you're way better off starting less, having less intensity, and working through that initially than really trying to crank it up on them in almost every case.
Right.
Whether you're trying to create strength and stability or you're trying to create range of motion and flexibility. That's why I always say 7's where you tell me to stop. We want to be 4 to 5. Better to to work gradually and progressively than to try to do too much and then have a response.
And remember, as John was saying, test, and retest. That allows you to understand what kind of changes that you're making. If you're making big changes in a short period of time, don't be afraid to shut it down right there. Remember, the body loves patterns. Don't take it out of the pattern too quickly.
So we're at 29.5. Now I would be at 9.5 right now if it was me. But let's have you just stand and stretch that quad gently. And keep the hips tucked in under so you're not arching the low back. And then from there you're trying to draw the knee back. And then slowly, gently release. Okay, great. Let's do one more. Once again, we do this, I do this with some of my athletes, 5 to 10 times, have them hold it for 5 to 10 seconds. You can do this laying on your side as well, which offers you a little bit more stability if somebody doesn't have the ability, like Chris, to balance here and control their balance.
Chris, so do you feel an increase in intensity when you put into that stretch position?
It does feel different. It might feel more springy at the ends, like I've got a little more give, which is quite nice.
Ideally, the positions that we want to put the patient in are positions that stimulate that stimulation, literally. So you'll feel it intensify more right over the pads when you're in the proper position. Always look for those positions. That's what I tell my patients and athletes, is always try and find new positions to stimulate that area. It helps to clean it up quicker.
So we're going to turn the stimulus down. Go ahead and let's check that quad again and just get a sense of, if it feels like it's a little bit more relaxed, you have a little bit more range.
Yeah.
Okay, great.